Demonstration of the use of the pinprick stimulator. What is a pinprick stimulator?
Hello. In this video, we will demonstrate the use of a pinprick stimulator. This is part of a sensory assessment protocol. The pinprick stimulator is used in clinical and research settings to deliver a controlled mechanical stimulus to the skin.
What sensory response does the pinprick stimulator measure?
It is commonly used to assess sharp sensation, pain sensitivity, and sensory changes across different body regions. The main sensory outcome assessed during pinprick stimulator is the participant's response to a sharp mechanical stimulus. This may include detection of sharp sensation, perceived pain intensity, or differences in sensation between test sites. The assessment can help identify altered sensory processing, such as reduced sensation, increased sensitivity, or pain in response to normally mild stimuli. It is often used as part of quantitative sensory testing, or QST, which provides a structured way to assess sensory function and pain perception.
What are the parts of the tool?
The pinprick stimulator consists of a handheld applicator with a small sterile pinprick tip. This is designed to apply a controlled stimulus to the skin. Depending on the device or protocol, the stimulus may be standardized by using consistent force, tip size, or application method. For safety and infection control, sterile tips are used appropriately, and the device is cleaned according to standard procedures before and after testing.
How is the pinprick test performed?
We will now demonstrate the procedure. May we begin with the procedure, please?
Yes, you can proceed.
May I please clean your upper arm?
Yes, you can.
So the participant is seated comfortably, and the test area is exposed and cleaned, as we just did. And in this demonstration, the pinprick stimulator will be applied to the painful area, in this case, the upper arm, or the arm. Before testing begins, the procedure is explained to the participant. The participant is instructed to report the intensity of the stimulus from 0 to 10, and the pinprick stimulator is then applied gently and consistently to the skin.
How are participant responses recorded?
Next, we will complete the assessment using the pointed skin probe. I will first apply one stimulus and ask you to rate how painful it is out of 0 to 10. And then I will apply a set of 10 repeated stimuli, and then you will rate the overall pain, that pain intensity that you felt during the full set.
Okay.
And we will repeat this procedure 3 times at the testing area, and that is your arm, and there will be a 30-second break in between the next set of 10 pinprick stimuli. So after each test, I will also ask whether you feel any lingering pain at the site for a few seconds. So please let me know if at any point you feel uncomfortable or the test becomes too uncomfortable, and I will stop immediately.
Okay.
So we will apply the pinprick 10 consecutive times at a rate of 1 contact per second using a metronome to keep time setting of 10 beats, 1 beat per second. So I will start the metronome app, apply the first stimulation, and you can rate it out of 0 to 10. This is the first one.
4.
I will now apply 10 repeated stimuli, and you will rate each individual stimulation.
4, 4, 5, 6, 6, 6, 7, 7, 7, 8.
And how would you rate the overall series of 10 stimuli?
6.
Thank you.
You're welcome.
So this is done 3 times with a break of 30 seconds between each set of 10 stimuli.
Why is standardization important?
And standardization is very important when using pinprick stimulation. Consistent instructions, body positioning, test site identification, stimulus intensity, application angle, and timing help improve the quality and reliability of this assessment. Using the same procedure across participants or across repeated sessions allow clinicians and researchers to compare responses more accurately over time or between body regions. Infection control procedures, including the use of sterile tips and appropriate cleaning of the applicator, are also essential for safe and consistent testing.
What is pinprick testing used for in clinical and research settings?
Clinically, pinprick testing can be used to assess sensory function and identify areas of altered sensation, such as reduced sharp sensation, hypersensitivity, or pain sensitivity. In research, it is commonly used as part of quantitative sensory testing protocols to examine sensory processing, pain perception, and changes in sensory following treatment or intervention. It is particularly useful in neurological, musculoskeletal, rehabilitation, and pain research settings.
What is the key takeaway?
So in summary, the pinprick stimulator provides a controlled and standardized method for assessing sharp sensation and pain sensitivity. When used with clear instructions, consistent application, and appropriate safety procedures, it can provide useful information about sensory function and pain perception in both clinical and research settings. Thank you very much for participating in today's assessment.
You're welcome.
Thank you.
Ethics and safety in pain assessment. Pain assessment should be conducted using standardized procedures while prioritizing participant safety, informed consent, comfort, and the right to stop. The clinician or researcher should monitor discomfort throughout testing and stop immediately if requested by the participant.